Fatty liver, causes, symptoms, and treatment. What is fatty liver disease? Fatty liver disease (FLD) means you have extra fat in your liver. You might hear your doctor call it hepatic steatosis. Most of the time, it doesn't cause symptoms. Drinking a lot of alcohol can make you more likely to get one type of fatty liver disease. Over time, too much alcohol leads to a buildup of fat inside your liver cells. This makes it harder for your liver to work. The good news is you can prevent or stop FLD with lifestyle changes. Fatty liver disease types. There are two main types of fatty liver disease. 1. Non-alcoholic fatty liver disease, NAFLD. This type is very common in the US, affecting 1 in 3 adults. Researchers aren't exactly sure what causes it, but obesity and diabetes will increase your risk of getting it. Unlike the other main type, you don't get it from drinking alcohol. There are 2 forms of NAFLD. Simple fatty liver. This means you have fat in your liver, but you may not have any inflammation in your liver or damage to your liver cells. It usually doesn't get worse or cause problems with your liver. Most people with NAFLD have simple fatty liver. Non-alcoholic steatohepatitis (NASH). This is much more serious than simple fatty liver. NASH means you have inflammation in your liver. The inflammation and liver cell damage that happen with NASH can cause serious problems such as fibrosis and cirrhosis, which are types of liver scarring and liver cancer. These problems can lead to liver failure and require a liver transplant. About 20% of people with NAFLD have NASH. 2. Alcohol-related fatty liver disease, ALD. This type is less common, affecting about 5% of people living in the US, and is caused by drinking alcohol. For this reason, it usually gets better when you stop drinking alcohol. If you keep drinking, ALD can cause serious problems. These include enlarged liver. It doesn't always cause symptoms, but you may have pain or discomfort on the upper right side of your belly. Alcoholic hepatitis. This is swelling in the liver that can cause fever, nausea, vomiting, belly pain, and jaundice, yellowish skin and eyes. Alcoholic cirrhosis. This is a buildup of scar tissue in your liver. It can cause the same symptoms as alcoholic hepatitis, plus large amounts of fluid buildup in your belly. The doctor will call it ascites. High blood pressure in the liver, bleeding in your body, confusion and changes in behavior. Enlarged spleen, a small organ inside your rib cage that's part of your immune system. Liver failure, which can be fatal. Alcohol-related fatty liver disease usually comes first. It can then get worse and become alcoholic hepatitis. Over time, it may turn into alcoholic cirrhosis. If you drink heavily, talk with your doctor. It's confidential, and they can help you get your drinking under control to save your health. Fatty liver disease symptoms. With ALD and NAFLD, there are usually no symptoms. Some people may have signs such as tiredness or pain in the upper right side of the belly where your liver is. If you have NASH or get cirrhosis, you may have symptoms such as swollen belly, enlarged blood vessels underneath your skin, larger than normal breasts in men, red palms, skin and eyes that appear yellowish due to a condition called jaundice, nausea, weight loss or loss of appetite, tiredness or mental confusion. Fatty liver disease risk factors. For ALD, the cause is too much alcohol. You may be even more likely to get it if you drink a lot and are obese, are malnourished, have chronic viral hepatitis, especially hepatitis C, are an African American or Hispanic male or have male anatomy, are female or have female anatomy because of the way alcohol is processed in women, are older. The older you are, the more likely it becomes. The reason why some people with NAFLD have simple fatty liver and others get NASH isn't known. Genes may be a reason. NAFLD or NASH is more likely if you have obesity or are overweight. Your body doesn't respond to insulin as it should, called insulin resistance, or if you have type 2 diabetes. You have high levels of triglycerides or bad LDL cholesterol or low levels of good HDL cholesterol. You're older. You have polycystic ovary syndrome. You have sleep apnea. You have an underactive thyroid. The doctor will call this hypothyroidism. You have an underactive pituitary gland. You'll hear this called hypopituitarism. You're malnourished. You've lost weight rapidly. You've been exposed to certain toxins and chemicals. You're Hispanic or Asian. You have metabolic syndrome. This is a mix of conditions that make you more likely to get type 2 diabetes and heart disease. With metabolic syndrome, you may have any three of these conditions: large waist size, high triglycerides or LDL cholesterol, low levels of HDL good cholesterol, high blood pressure, high blood sugar. There are also some less common reasons why you may get NAFLD or NASH. They include medical conditions that affect how your body uses or stores fat, hepatitis C or other infections, fast weight loss, taking certain medicines such as glucocorticoids, methotrexate, Rumitrex, Trexel, synthetic estrogen, tamoxifen, Nolvadex, Soltamox, and others. Gallbladder removal. Some people who have surgery to remove their gallbladder are more likely to have NAFLD. Fatty liver disease and children. About 10% of children in the US have NAFLD, and numbers are growing as the number of obese kids grows. NAFLD is also more common in older children rather than younger children, Hispanic and Asian American children rather than white and African American children, least common, boys rather than girls, though it's equally common among children with NASH. But most children with NAFLD don't get liver problems, and NAFLD can be controlled or reversed if your child changes their lifestyle and eating habits. Fatty liver disease diagnosis. Because most people don't have symptoms, these conditions aren't easy to diagnose. Your doctor may use different methods to find out if you have fatty liver disease. Some of the things your doctor may use to diagnose fatty liver disease are health history and physical exam. Your doctor will ask about your alcohol use. This information can help your doctor tell if you have ALD or NAFLD, so be truthful. They'll also ask about medications you take, how you eat, and other health conditions you might have. Your doctor will also check your body for signs of liver problems such as an enlarged liver or jaundice. Check your height and weight to calculate your body mass index (BMI). Your BMI determines how much you should weigh based on your height. Blood tests. Your doctor may order the following blood tests: liver function and liver tests to detect and monitor liver disease and damage. The cells in your liver have proteins called enzymes. When these cells are damaged, the enzymes leak into your bloodstream, where they can be measured. If your liver is damaged, the level of these enzymes will be higher than normal. Fibrosis assessment tests to estimate your level of liver scarring fibrosis. These blood tests result in a score that estimates your level of liver scarring or fibrosis. Lipid profile to measure blood fats, such as cholesterol and triglycerides. Hemoglobin A1C, which shows how stable your blood sugar is.